What are the so Gaurav, you must be having some idea about the ESR.
Yes, sir. Yes, sir.
Okay, so tell me something about the ESR. Like
So, yes, sir. Basically, sir, we ESR is a method that we do for the RBCs. Generally,
mhm.
sir, to show the how much time it takes to undergo in the coagulation, sir. Uh,
No, Gaurav,
sir,
Gaurav,
making
not
filing, checking with each other, sir.
not coagulation. See, don't be just be calm. Okay, see coagulation. See in which first of all, who will answer this question? Like when we do ESR, which type of tube we take?
Sir, Western green we take.
No, the sample. When we draw the sample
The
from the patient.
anticoagulated.
Yeah, EDTA. Yeah, that's true. That's true. So we take that is the basic thing. First of all, when you draw the sample from the patient, because we have tube like we have anticoagulant also, there are two tubes are there, EDTA and citrate. And of course, one is the sterile when we take for the serum. So what Gaurav was telling that the blood will clot. No, it won't clot because we're taking a tube which has an anticoagulant. And which anticoagulant? So there are two anticoagulants are there, EDTA and citrate. So if you take in different tubes, the methods are different and the values are different. Okay, so Gaurav, first of all, it's not coagulant. Blood is not clotting.
Okay,
It's
sir.
about that. Yeah, see. The thing is that if you answer such kind of answer in a Viva, it will be very bad. Okay, so it's not. It's
Okay,
about
sir.
just stacking of the. Basically, it's about the gravity thing. Blood have RBC. Blood have plasma. In plasma, there are proteins. There are water. If you place the whole blood with anticoagulant in a long tube, so it will try to sediment with the effect of gravity. So the name ESR itself says that erythrocyte sedimentation rate. So at what rate? So there are factors which are in the plasma, there are factors which are in the RBC, which will ultimately decide the its sedimentation rate. So basically, and then we can infer from that what are the various conditions which can be given probable idea that what could be the reason. So it's not a coagulation, it's about the sedimentation. The name itself say that it's a sedimentation. Okay. So Gaurav, you do want to add something to it?
Yes, sir.
Do you want to add something to it?
No, sir. I have just said that about the Western green tube in which we perform just test, sir.
Okay, so coming to the so little bit little about I will come to the tube methods. Little bit just a brief synopsis about the what is the ESR.
Okay, sir.
So one of the most important thing about ESR is that it's very cheap. It can be done anywhere. So you always we should. I have seen in many like Vivas people start giving very hi-fi. Any examiner try to know the most commonest thing. So the most important thing about ESR is that it could be done anywhere, any village which have no resources there, because we just need a tube, you just need a Westergren tube and just someone to draw the sample. So the most important thing about ESR is it's the simplest thing and it's very cost effective. Hardly with just a tube cost, a syringe cost, and just a tube. That's it. So it is the most important thing of ESR is very cheap, the cheapest, perhaps is the cheapest investigation because we doesn't why it is cheapest, it doesn't require no reagent is required, just a irritated tube and that's it. And ESR is basically screening test. Okay, and now coming to the so the same thing is that we put anticoagulant to this, what you're seeing in this PPT, this slide. The same thing is there, what we were talking about. And the ESR is governed by the balance between which I was telling that the pro-sedimentation factor, like, see what happens, the RBC try to fall down, okay? RBC try to fall down, but there are something which is trying to prevent it fall. And what are those things? Those things are which are in the plasma. So there will be the water, there will be the plasma protein. So any interplay between them, between the RBC and other factor which preventing their fall, which will decide ultimately what would be the sedimentation rate. Okay. So who will tell like someone like what are the effect of plasma protein? Anyone want to volunteer?
Sir, plasma proteins like fibrinogen are positively charged and surface of
Okay.
RBC is negatively charged. So
Okay.
they act like a gum to stick RBCs together and they
Okay.
lead to rouleau formation, which decreases the time in which which increases the ESR.
Okay, that's true. Okay. And what about the RBC size and number?
Sir, the more the RBC number, the lesser will be the ESR.
So don't you think so? It's like it's a little bit illogical. Like you're
नहीं
telling
सर,
that.
सर
If you
मतलब
see
जैसे
from.
आरबीसी
बताओ बताओ हाँ.
सर मतलब जैसे आरबीसी है जो कि ऊपर वाली साइड को पड़ा है ट्यूब में, अब उसे नीचे सेटल करना है, तो एक तो हो गया जिसके अंदर कम आरबीसी पड़े हैं उसमें तो वो आराम से नीचे सेटल कर जाएगा। एक जिस ट्यूब के अंदर ज्यादा सारे आरबीसी हैं उसके अंदर आरबीसी को बड़ी जैसे भीड़ से गुजर के जाना पड़ेगा, इसलिए उसके अंदर ईएसआर कम हो जाएगा।
ओके अच्छा ये बताओ क्या कहते हैं अनीश, जैसे कि अगर डिफॉर्म्ड आरबीसी जो होती है ना डिफरेंट, जैसे कि आरबीसी में डिफॉर्मिटी होती है उसमें ये सर घटेगा कि बढ़ेगा?
सर उसमें तो घटेगा ही, क्योंकि सर ईएसआर बनने में एक जो बड़ा अच्छा कंट्रीब्यूटिंग फैक्टर होता है वो होता है आरबीसी की शेप, क्योंकि हमारी आरबीसी की शेप है बाइकॉनकेव फ्लैटेंड सी शेप है, तो एक कॉइन लाइक शेप होगी ना, तो उसके कारण रूले आसानी से बन पाता है। अगर मान लो हेरिडिटरी सेफरोसाइटोसिस जैसी बीमारी है उसके अंदर गोल होगी आरबीसी, तो गोल चीजें थोड़ी ना कभी पाइलोन हुआ करते एक दूसरे के ऊपर, तो ईएसआर उसके अंदर तो कम ही होगा।
वेरी गुड अनीश, दिस इज बहुत अच्छा, अनीश ने बहुत अच्छा आंसर दिया। इट इज वेरी कॉमन सेंस, लाइक जैसे कि तुम लोग कैरम बोर्ड तो खेलते हैं हम लोग ना, अब जैसे कि कैरम बोर्ड का कॉइन होता था ना, इट्स समथिंग लाइक दैट कि एक कॉइन के ऊपर एक कॉइन रखोगे कितना अच्छे से हो जाएगा, वो पूरा एक शेप में है, लेकिन अगर डिफॉर्म्ड होगा तो ऐसे भी नहीं हो पाएगा। सो व्हाट अनीश हैज गिवन, ही हैज गिवन वेरी गुड, एंड अनीश हैज अ वेरी गुड concept. This is very nice. Now he doesn't need to remember it. Just ask him any question to Anish, so he will just answer it. So it's very good. Like, you know, if you study concept wise, it's very nice. So Anish, good Anish, yeah.
Thank you.
So who will tell about these phases of the sedimentation and what are the significance?
Sir, like first of all, there is the Rowlatt's formation. And then formation.
It's a Gaurav, it's a rouleau. X is silent.
Rouleau formation.
Then X is silent. Yeah.
Formation of fine threads. And sir, in the last is the packing phase. In between, there is also a rapid falling of protein network along with red cell mass.
Okay.
So this all phases include 15 minutes separately, all phases, sir.
So is there any significance like with respect to the results in the different phases, like initial phases and the packing phases? Is there any significance?
Sir, in first phase rouleau formation, there is a minimum sedimentation occurs.
Okay.
In the formation of fine threads, sir, it is due to the globulin and the fibrinogen plasma proteins, that is.
Yeah, good, Gaurav. Yeah. Okay, so who will tell what is this? Anyone? These are tubes. Which is this tube?
Westergren paper. Yeah, Westergren paper.
Yeah, these are the Westergren tube. Okay, and this one? Any idea?
Ventrum tube.
Okay. And what would be the normal values of the like who will tell normal values and tell me the normal values and the clinical significance, like if it is raised, what we can say, if it is decreased, what we can say. Who will volunteer?
So ESR normal value for women is between 0 to 20 and for men it's 0 to 9.
Who is this? Bhavna? Bhavya.
So Bhavya.
Bhavya. So Bhavya, you rightly, but is it for 1 hour or 2 hours you're telling?
So per hour.
So actually, whenever you see like a unit, like anything has a unit. So yes, sir. Whenever you say, even if for an investigation report, you will the sheet there hour is also mentioned. So that hour has to be mentioned because some lab give it 1 hour, some give it 2 hours, but usually it's 1 hour. Okay. And tell me the Bhavya, like when it will be raised and when it will be decreased.
So it can be raised in subsequent of physiologically in pregnancy because there is anemia in pregnancy. And there could be general cases of anemia, but leaving behind the sickle cell and the spherocytotic anemia, because as Anish explained, unke andar change hota hai shape ka. So the anemias in which there is change of shape, they are to be excluded. Then there could be inflammatory disease. Then so tuberculosis, SLE, autoimmune disorders.
Can you tell me, Bhavya, why in inflammatory disease, inflammation, basically in general, ESR, even idea that there is some inflammation is going on. It's a very non-specific indicator. So why in any inflammatory condition ESR is raised?
Sir, because in inflammation there is
clumping of them. And because of the clumping, the ESR increases.
Yeah, Bhavya, let Devesh want to tell something. Yeah, Devesh, yeah.
Sir, in inflammation there is release of acute phase reactants. तो उनमें एक fibrinogen भी एक अच्छा मतलब acute phase reactant होता है, तो वो ज्यादा रिलीज होता है, तो उसकी वजह से ज्यादा ESR बढ़ जाएगी.
And what is the mechanism, like how the increased fibrinogen leads to the increased ESR?
सर क्योंकि फिब्रिनोजन पे जैसे अनीश ने बताया था कि पॉजिटिव चार्ज होता है, और सिंस आरबीसी मेम्ब्रेन आर नेगेटिवली चार्ज, तो ज्यादा पैकिंग अच्छी हो पाएगी.
Okay, good Devesh, yeah. This is a formula. I don't know if I'm very good at this formula, but this is for theoretical purpose. We can just look at for this, yeah. So, okay, this was the adult female, 0.20 millimeter per hour. So, accurate per hour also, okay. So, we have already discussed, like Devesh and Gaurav and Bhavya all have told the mechanism of ESR, we have already discussed. And the procedure. So, the minimum the patient should be the 4-hour fasting. So basically, practically, we tell that patient to come like empty stomach. So why we call the patient in empty stomach, or minimum 4-hour fasting is required? Who will answer this question? Yeah, hello. There must be some other people also. Jivesh, Anubhav is there? Hello. Hello, am I audible?
Yes, sir, you are.
Yeah.
Yes,
so
sir.
Yeah.
Sir, can I give it a guess, sir? I confirm you, sir. सर पोस्ट पेरेंडियल एल्कलाइन टाइड होता है ना सर, खाने के बाद, तो सर उससे पीएच बढ़ जाएगा.
पीएच
तो सर अगर सर मतलब गैस है सर, वाइल्ड गैस, मुझे ऐसा लगा.
ये वो हो
सर, पर ये तो कंफर्म है सर, पोस्ट पेरेंडियल एल्कलाइन टाइड तो होता ही है ना सर, ये तो कंफर्म है.
अरे ये सिंपल सी बात है यार, खाना खाओगे पानी रहेगा तो वाटर से क्या फर्क पड़ेगा? मोस्ट इम्पोर्टेंट थिंग इज दैट
डाइल्यूशन हो जाएगा तो रिलेटिव एनीमिया होगा.
तो ये तुम जो बोल रहे हो ना, ये मैंने पढ़ा नहीं है ये, हाँ, बट इट्स अ लॉजिकल गेस, गुड गेस. इसको भी आई हैव नेवर स्टडीड अबाउट समथिंग लाइक दैट, बट यस इट कुड बी, सो इट इज अ गुड गेस एक्चुअली. ओके, सो द प्रैक्टिकली वी जस्ट कॉल द पेशेंट इन द एम्प्टी स्टमक. तो ये सब में फर्क पड़ता है, हालांकि देखो क्लिनिकली कोई फर्क नहीं पड़ता है, बिकॉज if the ESR is 30, if here is 40, 50, doesn't make any sense. So it is just a theoretical thing. Practically it doesn't make any sense. ESR is a very non-specific thing. Okay, so who will tell the procedure? Yeah. Like, have you ever done this? Have you seen how it is done?
Yes, physiology में क्या था?
Okay.
So, like we first take the blood out from the body, like by the septic procedures, and then it has to be mixed with the EDTA anticoagulant. So then we have to take 2 ml of blood out of the mixture that is already EDTated. Then we'll add sodium citrate solution. So I don't remember कि कितना डालते थे. And after we gently add it, after we have to just mix it. And after that, then we have to put it in the Vintrobes tube, and then we have to keep it under gravity for an hour.
So you tell me the practical thing. Measurement ऊपर से लेते हैं कि नीचे से लेते हैं? कहाँ के लेते हैं measurement? I mean like tube में
So 0 से 20 ऊपर से नीचे होता है.
Okay, that's good. This is this is a very common thing, a simple thing, but sometimes we initially when I was in first MBBS, I tend to forget. I used to tell opposite. So you must remember all this thing. Okay, nice. Okay. This thing Bhavya was there, no? So it's okay. You can study this as a theoretical thing. Procedure Bhavya has already told, and the requirement of Winthrop and the Vestergain are a little bit different. So it's just a theoretical thing. You can just proceed. We've already done that. So yes, there are few conditions like when the ESR are very high. This question can be asked in the Viva. Maybe in the I don't think it's in theory, but maybe in MCQ. But in Viva it can be asked that what are the conditions associated with the very high ESR. So ESR, of course, there it is.
Excuse me,
yeah.
Dr. Manish. I think you should explain the procedure, student. Okay. The Westergain method and Westergain method, both procedure, you explain first of all of them. Okay.
Okay.
Explain them. Sometimes the examiners ask. Okay. First of all, them explain, then ask questions about them. The procedure. Okay? Explain them.
Yeah. Okay. So in the Westergain method, so let's discuss the Westergain method. So the Westergain tube is a pipette is open at the both end. So it's the length is around 30 centimeter and the diameter is 2.5 millimeter, and the lower 20 centimeter marked with 0 at the top. So which I was previously telling that where is 0? 0 is at the top or 0 at the bottom. So 0 at the top. And the anticoagulant used in this method is 3.8% disodium citrate solution. So we take it from the pipette and 0.4 millimeter of trisodium citrate is added in 2 milliliter of blood. And the pipette, and how the pipette is filled? Pipette is filled by sucking the blood and up to the 0 mark. So we mix the blood and we fill the Westergain tube up to the 0 mark and fix it vertically in the Westergain stand. So there's a stand. So we mix the blood with the anticoagulants and we fill it up to the 0 mark, and we then put it in the Westergain stand. And then we put a timer on, and we have to read after the 1 hour, the reading of the upper portion till where it has fallen to after the 1 hour. And then we have to note the reading. Now Winthrop has a different method, but here's again the same thing. We need a Winthrop pipette, and we need an anticoagulant, and we need a Winthrop stand. As with the Westergain, also we need a Westergain pipette, anticoagulant, and a Westergain stand. So here same thing, but the name are different, and little bit processes are different. The Winthrop tube is open at one side only, as compared to the Westergain tube, which is open at the both ends. The length is 11 centimeter and the diameter is 2.5 millimeter. And the lower 10 centimeter are marked as compared to the, in the Westergain it was 20 centimeter. Marking the same. Marking in the Westergain tube and marking in the Winthrop tube is the same, like we have 0 at the top and the 100 at the bottom. The anticoagulant used here is the EDTA. That's the difference in the in the Westergain we use the citrate, and in Winthrop we use the EDTA solution. So this is an important thing question you usually ask, like what are different anticoagulant used for the Winthrop and the Westergain. Which previously I was telling that anticoagulant is needed, but there are EDTA and there is a citrate and for different process. So this is very important question. You should remember that, especially many examiners ask in the Viva. The specific question they will ask that which anticoagulant is in the Winthrop and which anticoagulant is in the Westergain. So this you definitely should remember. There should be no confusion about that.
Also, Dr. Manish, also tell them the ratio also. Okay, what is the ratio for the blood to anticoagulant to use? Okay, that is also explained. That is also important in practical exam. Okay, about the ratio of blood to anticoagulant ratio.
Yeah. Just a minute. Yeah. If you see the ratio, like in the case of Winthrop, you need a 0.4 ml of anticoagulant and 2 ml of blood. So it is 1:5 is the ratio. In the Winthrop, we need a 0.4 ml of anticoagulant, that is the ED, and we need a 2 ml of blood. So it's to 1:5 ratio. So here the procedure of the Winthrop, with the help of a long naked Pasteur pipette, is the name of a pipette used in the Winthrop method, or a special syringe, whatever is there. The Winthrop tube is filled up to the 0 mark, and exactly the same thing as the Westergen method. We mix with the anticoagulant 1:5 ratio, and we place the tube exactly in the vertical position. And again, we start the timer on, and after 1 hour, we take the reading. So this is the process. Any question? Anyone want to ask any question regarding this? Any queries?
सर कोई डिफरेंस है क्या, मतलब एक में हम सिट्रेट ले रहे हैं, एक में ईडीटी ले रहे हैं, तो सर कुछ खास बात है क्या? कोई भी ले सकते हैं ना?
नहीं, वो उसका दोनों का मेथड में उसमें उसी के लिए बना है वो। विंट्रॉप का रेफरेंस लेवल यूजुअली वेस्टर्गन से करते हैं, कभी बहुत बार वो अवेलेबल नहीं होता है तो फिर उसमें वो करते हैं। फिर इंस्टीट्यूशन टू इंस्टीट्यूशन भी वैरी करता है ये वाली बात की, कहीं पे वेस्टर्गन मेथड होता है, कहीं विंट्रॉप मेथड होता है, बट मोस्ट कॉमनली यूज मेथड इज द वेस्टर्गन मेथड। फॉर वेस्टर्गन वी नीड अ साइट्रेट, बट ऑन विंट्रॉप वी नीड द ईडीटीए।
सर मैम ने जो ब्लड टू एंटीकोएगुलेंट रेशियो के लिए बोला था, वो दोनों के लिए सेम ही है ना, 5:1?
एक मिनट, मैं कभी इसको तो मतलब भूल जाता हूँ।
वही तो है, दोनों में 0.4 मिलीलीटर और
0.5।
एक्सक्यूज मी डॉक्टर मनीष।
या
हाँ, ये आपने कहाँ से लिया है इसी वाला टेक्स्ट?
ये तो कहीं पे था, कंप्यूटर में पड़ा हुआ मेरे लैपटॉप में कहीं से। हाँ,
तो ये रेशियो 1:5 कहाँ से लिया आपने? आपने ये डेसी से लिया कि नहीं लिया? डेसी देखा कि नहीं देखा अपनी जो बुक है उसका प्रैक्टिकल हेमेटोलॉजी वाला?
नहीं, डेसी तो नहीं देखा मैंने।
डेसी या फिर हेनरी के 1:4 रेशियो for that anticoagulant versus, okay, 1:4 ratio. I don't know how is the 1:5 ratio. Okay, the ratio should be 1:4 for the ESR.
Okay.
Okay.
Yeah.
1:4 ratio. That is asked many times in exam. Anticoagulant types and the ratio always asked. 1:4 ratio and anticoagulant citrate for the this Westergen pipette and Winthrop tube for the EDT. Okay, so we should correct it.
Yeah, sure. Thank you.
Okay.
हेलो
मैम, तो फिर हम ये मैम जो हम फिर ये 0.4 में
हाँ, यहाँ इसको करेक्ट करना है। जैसे लेना है 1 part blood and 1 part anticoagulant and 4 part blood लेना है। That is a 1:4 ratio. Okay, you explain them. ये डाटा थोड़े डिफरेंट है। You tell them like that 1 part is anticoagulant, 4 part is blood. 1:4 ratio में we should take blood in tube, Westergen tube. Okay.
Yeah, okay. So okay, ma'am has corrected it. So yeah, it is 1:4 ratio. We have to 1 part to anticoagulant and 4 part blood. So 4 times the blood, 4 times from the anticoagulant, the blood is to be taken. Any queries? So I think we are done with the process. So we will tell that what are the conditions like with the ESR are markedly raised. Hello, am I audible?
Yes, sir.
Yes, sir, you are audible. Sir, the conditions in which ESR is markedly raised are multiple myeloma, autoimmune disorders, tuberculosis, malignancies, connective tissue disorders, and sir और एक और थी वो नहीं याद आ रही.
चलो कोई, that is good. What is was Gaurav? Yeah.
Yes, sir. Rheumatic fever is the.
Okay, nice. There are some drugs also, like which may this is like not so clinically so significant, but theoretically yes, which decreases the ESR, like some oral contraceptives, penicillamine, theophylline, vitamin A, and some decreases, some increases, like all this is thing like methyl-dopa contraceptive OCT. But it's clinically not so significant, maybe theory. Who will tell about the condition where we have a low ESR?
Sir, polycythemia होता है.
Okay, so why polycythemia there will be low ESR? We have already discussed it, but someone else answer this question. Why in polycythemia we have a low ESR?
सर क्योंकि उसमें आरबीसी बहुत सारे होंगे, तो फिर जब नीचे जा रहा होगा तो फिर बहुत ज्यादा भीड़ सी होगी, तो इसलिए उसकी सेडिमेंटेशन डिक्रीज हो जाएगी.
Okay, right. And apart from that, apart from
hyperviscosity.
Pardon?
Hyperviscosity.
Okay, hyperviscosity. Okay. So what are the clinically where we get the hyperviscosity?
So lymphoma, multiple myeloma. No, we see it in lymphomas and leukemias.
Okay. Okay. Well, coming to like we were discussing like acute inflammation, who will tell us like what are the other inflammatory markers? Like we tell like someone was telling about the inflammatory markers are raised in the inflammation. Acute phase reactant are raised in the.
Sir, interleukin 6 और आजकल तो जैसे CRP भी कर रहे हैं. C रिएक्टिव प्रोटीन, क्योंकि इन्फ्लेमेशन में C रिएक्टिव प्रोटीन बढ़ जाता है.
तो आजकल नहीं कर रहे हैं, but that was always there, but yes, in case of COVID
में आजकल बहुत ज्यादा कर रहे हैं.
But it is always done in any inflammation acute. We always do that. CRP, interleukin, ferritin is also there. Acute phase reactant, ferritin is also there. Ferritin, CRP, IL-6. So in that way, because I mean, like a substitute for ESR. So like suppose if ESR cannot be done, not possible. So like it can also be used. However, this is a little bit paradoxical because these are much more specific as compared to the ESR. But still, that can be a question in the Viva that what could be a substitute for the ESR. All other inflammatory or acute phase reactant can be a substitute for the ESR. However, this could be retrospective that what could be the substitute for other like this ferritin and interleukin and CRP. ESR could be a substitute for that practically, but okay, it can be used in both way around. Interchangeably, it can be used. So what do change an ESR mean? Okay, we have already discussed clinically. So okay, shall we switch over to the hemolytic anemias? Any query regarding the ESR?
Sir, what is the reason of raised ESR in leukemias?